Hello, Marching Mizzou. Today we're going to talk about common injuries that you might have by being a marching athlete and what you might do to prevent those. In this video, we're going to be going over injury prevention as well as heat, cold, and compression therapy. And then we're going to get to some common injuries and symptoms, injury management options, and painkiller safety. Going over injury prevention might seem like common sense to some people, but it is an important topic to discuss. It's important that we go over proper training practices as well as warm up and cool down routines so we can have a healthy season in Band 138. It's super important to wear the proper sporting gear like proper shoes and athletic clothes that are moisture wicking and aren't going to be super hot. In addition to that, it's important to dress appropriately for the weather, and improper warm up and stretching techniques are a huge cause of injury. So it's important that we continue those marching health exercises. You take your time doing your stretches as well as doing a cool down. In athletes, some very broad common injuries that we see most often are sprains and strains, joint injuries specifically to the knee and the ankle, general muscle injuries, dislocations, fractures, Achilles tendon tears, and pain along the shin bone, also called shin splints. Some good ways to prevent injury are as follows. Developing a strong fitness plan. Your fitness plan should be reliable, something that you can realistically repeat, and something that'll keep you in shape for when season starts. You want to include cardiovascular exercise, strength training, and flexibility work. This will decrease your chance of injury by making you a very well-rounded athletic person. Another great way to keep in shape for marching season is to alternate different muscle groups. When you develop that fitness plan, you might want to develop a rotation of what muscle groups you want to work each day. Like on Mondays, you do legs, Tuesdays, you do abs, Wednesday, arms and shoulders, and following along with all the major muscle groups in your body and rotating between them so you don't over or underwork anything specifically. One of the biggest stressors can be dehydration. When it comes to being in the sun for 8 to 12 hours a day, and on top of that, doing physical exercise, dehydration is super easy to come upon a person during band camp. It's important to drink water before you start exercising or working out. That way you can prevent dehydration in the future. Also keep in mind that there is a certain amount of water intake that's required to fuel a person per day, and when exercising, you have to add a certain percentage more to maintain proper hydration. Another huge way to stay healthy and generally in shape during season is to wear proper footwear. The feet are your contact point from the ground, so an injury to the foot can lead to upstream injuries in your shin or your upper legs and hips and your spine. And because your foot is such an important base for the rest of your body, they need to be properly supported when you're engaging in athletic activities. One of the most common and overlooked ways to injure yourself during an athletic activity is simply to lack the proper posture or technique that is usually required of that action. We go through proper techniques and fundamentals, and it's important to remember the proper positions to do those in. By changing positions because you're tired or because you're already hurting only increases your risk for injury. They're taught a certain way because that is what's safest for our bodies, and straying from that can cause injury. In addition to that, don't be afraid to take a break. If you're having trouble completing some sort of fundamental or having an action with proper technique, it's okay to take a break. It's easier to take a break than to have to recover from an injury. One of the most common and overlooked ways to injure yourself during an athletic activity is simply to lack the proper posture or technique that is usually required of that action. Heat therapy works by improving circulation and blood flow to a particular area due to increased temperature. As shown in the diagram, increasing the temperature of an afflicted area can soothe discomfort and increase muscle flexibility by causing vasodilation. There are two different types of heat therapy: dry heat and moist heat. Both types of heat therapy should aim for warm as your ideal temperature instead of hot. Dry heat, also called conducted heat therapy, includes sources like heating pads, heating packs, and saunas. This heat is very easy to apply. Moist heat, or convection heat, includes sources like steamed towels, wet heating packs, or hot baths. Moist heat may be slightly more effective, and it requires less application time for the same results as dry heat. When applying heat therapy, you can choose to use local, regional, or whole body treatment. Local therapy is best for small areas of pain, like one stiff muscle, and you could use a small heated gel pack or a hot water bottle if you only want to treat an injury locally. Regional treatment is best for widespread pain or stiffness and can be achieved with a steamed towel or a large heating pad. Full body treatment includes options like saunas and steam baths. Cold therapy, and in medical settings, cryotherapy, works by reducing blood flow to a particular area, which significantly reduces inflammation and swelling. This can stop pain, especially if it's around a joint or a tendon. It can also temporarily reduce nerve activity, which relieves pain. Several ways that you can apply cold therapy to an infected area are things like ice packs, frozen gel packs, coolant sprays or lotions, ice massage, and baths. Compression therapy is a common treatment used to help improve blood flow in your limbs. It usually involves the use of elastic stockings or arm wraps, and that elastic provides compression that can help prevent blood pooling and fluid from building up in the compressed areas. This helps by allowing your blood to circulate quicker back to your heart, which takes some stress off of that cardiac system. Here are some lists of great at-home options for heat, cold, and compression therapy. It's just as important to know the risks of these therapies as it is to know the positives. Some risks of heat therapy is you want to have warm heat, not hot heat. So you do have a risk of overheating and burning your skin. It's also important to keep in mind that providing warm heat can also produce a risk for infections by providing a warm environment that bacteria like to thrive in. If you are concerned about a potential bacterial infection, it is probably best not to use heat therapy. With cold therapy, you want to make sure that you're not overcooling the area and that you only use this therapy for a limited amount of time. You also want to avoid direct application. If you're using cold therapy like an ice pack or a cold gel pack, you want to wrap that in a paper towel to avoid direct contact with the skin, which could cause damage. With compression sleeves or compression therapy, you could see some skin irritation and discomfort because sometimes compression can be too hard. You also want to avoid overcompression or leaving compression on for an increased amount of time than recommended. It also provides an environment where, in an athletic setting, you will be sweating, wearing these compression objects, and you could increase your risk for bacterial and fungal infections or just general and increased amount of germs. And you could see swelling in other areas of your body if you use compression in an incorrect way or for too long. Continuing with the video, I now am going to go over, once again, these common injuries and symptoms that you might have, as well as how you might treat them by wrapping with an ACE bandage. If you're having a flare-up in a foot injury, an ACE bandage can be a great way to alleviate symptoms and provide protection and support to your foot. In addition to heat retention, an ACE bandage can also be used for compression. Wrapping the bandage around your foot is a great way to protect your foot and promote healing. However, when wrapping, you must be sure to not cut off circulation. Applying an ACE bandage is simple. Wrap it around your foot and ankle, making a figure-8-like pattern, starting at the toes and wrapping back towards the ankle. Use a light pull to keep the ACE bandage taut, and repeat as necessary. You can repeat this wrapping process until the swelling subsides, but if the symptoms do not go away in a reasonable amount of time, you will want to remove the bandage and see a doctor. This example using an ACE bandage is similar to the previous example, however this will focus more on wrapping the ankle rather than the foot. Start circling your way around the arch of the foot while pulling the bandage diagonally from the bottom of the toes across the foot's top and circling it around the ankle. Bringing the bandage diagonally across the foot and under the arch in a figure-8-like pattern will provide the structure your ankle might need. A wrap should cover the entire foot and end about 8 to 10 centimeters above the ankle. Most compression wraps like this one are self-fastening or come with clip fasteners. If not, you can use tape to secure the end. The wrap should be snug but should not cut off circulation to the foot. When wrapping your shin, you'll want to begin down by the ankle. Holding one end of the ACE bandage above the ankle, you'll want to begin to wrap, moving your way up towards the knee. Keep in mind that you do want to keep some tension in the bandage, but not cut off circulation to your foot. Ensure that it is tightly wrapped by pulling out any slack, but not overstretching the fabric. When you're finished, you want to end an inch or two below the knee so you can allow joint movement in both the ankle and the knee. To wrap with an ACE bandage for a knee injury, begin by wrapping the upper calf 2 or 3 times. Then, cross the bandage diagonally up behind your knee. Wrap above the knee 2 or 3 times before crossing back down behind the knee to the same spot where you wrapped your upper calf. Complete this pattern as many times as you need to use your ACE bandage. You want to avoid covering the kneecap and preventing losing your range of motion. Similarly to wrapping the shin and calf, when wrapping the quad and hamstring, you will want to hold the bandage horizontally. Beginning about an inch to an inch and a half above the knee joint, you will wrap the bandage in circles around the thigh until you reach the highest point where you are able to wrap before running into the hip joint. Some doctors argue that you should wrap your quad and hamstring while standing on a slightly elevated surface. One way you could do this is by putting a block under your heel and leaving your toes on the ground while resting your heel on the block. When wrapping the bicep and tricep area, just like other long bone wrapping, you'll want to begin about an inch above the elbow joint. You want this wrap, again, to be tight, but without restricting movement or circulation completely. You'll begin an inch above the elbow and circle the bandage over itself until you get as close to the shoulder joint as is comfortable. To wrap the elbow, you will want to begin below the joint itself. You will start the wrap by wrapping a couple circles around your arm below the joint. You will continue to wrap above the joint, and you might consider leaving a small space for your elbow to hinge as its normal motion. You will wrap a couple times above the elbow and continue this as many times as you need before you run out of wrap. Wrapping your wrist as well as wrapping your forearm will function similarly. You will begin by wrapping twice around your hand between your thumb and your palm before making a figure 8 down to your wrist and circling as far up on the forearm as you feel pain. If you are wanting to wrap more for wrist pain than forearm pain, keep the ACE bandage centralized further around the wrist than moving up the arm. You will want to finish a forearm or wrist wrap by doing a couple more circles around the hand and then finishing off your bandage. If you personally feel that wrapping using an ACE bandage does not give you the support or compression that you want, there are other options. You could use a brace, you could use athletic tape, you could use over-the-counter painkillers to reduce swelling and your need for compression. And some good ways to treat swelling, if you come across them besides over-the-counter painkillers, are heat, ice, and compression, as well as rest and elevation. That being said, if you choose to treat your swelling and pain with painkillers, please know how to take them safely. I cannot stress how important that is and how overlooked it is by people today. Over-the-counter painkillers are available from pharmacies, and they can relieve acute pain. Their effectiveness depends on things like the type and severity of the pain and the dose of the medication. Painkillers that are available without a prescription have been approved for treatment of mild to moderate pain, and they should not be used for more than a few days in a row. The specified maximum daily dose should not be exceeded. Painkillers have, in rare cases, led to complications, and they do have side effects. In order to avoid these adverse effects, it's important to make sure you use them properly and safely. This is particularly true for people who have medical conditions or use painkillers regularly. A medications package contains detailed information about its areas of use, correct doses, and how long you should use it for. If you find yourself using a painkiller for longer than the box recommends, talk to a doctor as soon as you can. The largest group of over-the-counter painkillers are called non-steroidal anti-inflammatory drugs, also known as NSAIDs. As their name suggests, they also reduce inflammation, but unlike other anti-inflammatory medicine, they do not contain steroids. Over-the-counter NSAIDs are used in the treatment of many different kinds of pain, including headaches, menstrual cramps, and toothaches. NSAIDs reduce pain and inflammation and also lower fever. Acetaminophen is another very widely used painkiller, and while it relieves pain and lowers fever, it does not reduce inflammation. In some medications, you can find that they are combined with NSAIDs, and caffeine is sometimes added too. It is not clear whether these kinds of combinations have any advantage or disadvantage over using active ingredients separately, and there are no good qualities comparing these two medications and individual drugs. The most common side effects of NSAIDs are in the stomach. They range from minor problems like indigestion and stomach aches to more serious problems like gastritis, ulcers, and bleeding in the stomach or bowel. The risk of complications can be significantly reduced by using other medications to protect your stomach. Proton pump inhibitors such as omeprazole or pantoprazole are typically used for this purpose. But over-the-counter painkillers very rarely lead to serious side effects because they should be taken for a short time only. Several analyses of studies in recent years have also shown that NSAIDs, such as diclofenac, increase the risk of cardiovascular disease, but that is mainly if you take high doses over a long period of time. Nevertheless, it is still a good idea for people at a higher risk of cardiovascular disease or those who already have cardiovascular disease to take low doses of ibuprofen or naproxen rather than diclofenac. People who have cardiovascular disease can take acetaminophen as an alternative to an NSAID. You can lower the risk of painkiller-related side effects and complications by paying attention to the package insert and following medication guidelines. A couple of other good rules of thumb for using painkillers safely are as follows. Always take as little as possible, as much as necessary. Take as small a dose as you can to relieve pain, and only take it for as long as you feel like you need it. Once again, if this exceeds about a week or even just a couple of days, talk to a doctor. Only take painkillers for as long as you really need them. Watch out for possible interactions with other medications. There are dozens of drug checkers online, so if you take a medication regularly and you're worried that a painkiller might affect its effectiveness, then look up one of these drug checkers and make sure that there are no signs or symptoms or interactions between the two that will be dangerous for you. And finally, check whether painkillers aren't suitable for you based on your risks and medical conditions. Tables like these exist all over the internet, and if you're concerned about the safety of your own painkillers, speak to a doctor or find a reputable site online. Thank you for finishing the Marching Mizzou Health and Safety series video on common injuries and prevention. Feel free to use any of these wrapping techniques as you feel fit, and consider looking into other options. Great YouTube channels that I will link below for athletic tape are sites like KT Tape and Rock Tape, and it's also never a problem to buy a brace if you feel like you need extra support while you're at Marching Band.